So I'm going to come onto the scene, make sure that our scene is safe. I'm going to put on proper BSI, which of course means gloves. If the situation called for it, I might consider putting on eye protection if there was squirting blood or anything like that. Potentially a mask, maybe a gown, but for sure put on gloves. So I have on my BSI, the scene is safe. My patient has an impaled object in their foot. So I am going to make sure, and if I see any active bleeding, I'm going to put pressure on that with a sterile bandage. I'm going to go ahead and put pressure on that. The bleeding has stopped, so we are going to, before transporting our patient, make sure that we have stabilized the object. We are not going to try and remove it at all. We are not going to wiggle it. We're not going to pull anything out from it. We are going to stabilize the object so that we can transport them appropriately. Say if that end was there, we would make sure that it is supported on both sides by different bandages. And then we would do this way easier if you had a partner who could hold on to the bandages as you attach them. So right now we're going to come over here, make sure the patient understands what you're doing, as Mr. Champion does not. And then depending on what the object is, you may need to do some kind of stabilization around it like that to really make sure that it's not going to go anywhere. Again, continue to bandage around, being very careful not to move or jostle the object too much, etc., etc. So we're going to make sure that we appropriately tie off the bandage. If I had butterfly clips or if I had my safety pins, which is what I'm going to use for this one, and make sure that we safety pin that. And then what we're going to do is we're going to continuously reassess the bandage and make sure that there's still a distal pulse if that's appropriate, and make sure that we haven't cut off circulation or anything like that, and just make sure that no vital signs have changed in the distal area, and make sure that the impaled object itself has not moved at all.